Results through research is not designed to and does not provide medical service, professional diagnosis, opinion, treatment, or services to you or to any other individual. Through this audio magazine and linkages to any websites, Results through Research provides general information for educational purposes only. The information provided in this audio through linkages to other websites is not a substitute for medical or professional care, and you should not use the information in place of a visit, call, consultation, or advice from your healthcare provider. Results through Research is not liable or responsible for any advice, course of treatment, diagnosis, or any other information, services, or product you obtain through this audio magazine.
Welcome to Results Through Research. RTR monthly audio series has taught millions of listeners how to make better choices concerning eating, lifestyle, and taking responsibility for your health. Being a non-sponsored source allows RTR to deliver the truth, the whole truth, and nothing but the truth. RTR is now heard on every continent in the world. Congratulations on becoming part of one of the fastest growing go-to wellness informational series on the planet. Now here is Doug Capporino.
This month on RTR, we're going to cover a subject that has actually been near and dear to my heart, but I've been reluctant to actually cover it before in the past because of my limited knowledge in the area. But first and foremost, I do want to welcome our new listeners from Denmark and Sweden. Thank you for being part of the RTR listening audience. So without further ado, I have an incredibly special guest this month. We have Dr. Lisa Palmer, who is a leading psychotherapist and international media expert, commenting on hot news topics and current events from all over the world, including mental health, addictions, trauma, criminal, and political psychology. Dr. Palmer has appeared on networks such as Fox, CNBC, and many, many more, including The Dr. Drew Show. Dr. Palmer is founder and program director of the Renew Center of Florida and has extensive experience in working with trauma, eating disorders, addictions, relationships, and high-performance clients. A human artist, Dr. Palmer utilizes a wide variety of Eastern and Western approaches and is known for her amazing, rapid hypnosis methods that instantly rewrites painful memories to remove negative reactions and produce positive feelings and behaviors. So today's subject matter is going to be about eating disorders. So without further ado, RTR, we welcome you, Dr. Lisa Palmer.
Hey, thanks for having me on the show. And boy, was that an introduction or what? Thank you so much.
You got a lot to stand up for here. No pressure. So again, we know, and I've done a little bit of research in this area, and from what I can tell, eating disorders really affect about 30 million people in our country. Is that correct?
That's absolutely correct. 20 million women and about 10 million men. A lot of people don't think that men actually struggle from eating disorders. They think that it's a woman's thing, but actually both men and women struggle from eating disorders.
That's incredible. So let's talk a little bit about the demographics of this as well. So low socioeconomic, high socioeconomic, young, old, medium age. What does it look like? What does that picture look like?
That's a really wonderful question. It's something on everybody's minds. Most of the time people think that people of higher economic status suffer from an eating disorder, but really an eating disorder can affect anyone if they're under critical stress or have, I did some research on the drive to self-starvation amongst immigrants to the United States. And I saw in that research that with this transition that they were experiencing, it didn't really matter what socioeconomic background that they were from. The fact is that they were, all human and experienced this stress, which caused them to want to gravitate toward anorexia.
So, interesting question here. When does the person who has the eating disorder recognize that they have an eating disorder, or do they never recognize it?
Sometimes when they're, like with most addictions, when they're starting to hit bottom and it's really starting to affect their health and their life in so many different avenues. And oftentimes people are trying to self-correct and self-medicate their issues. And Oftentimes they're looking for help only when they absolutely have to. So it's the same thing with an eating disorder. When their health starts to break down, or they start to have relationship problems and financial stress and other types of pileups in their life, and it's really taking a toll on them and they can't take it anymore. Eating disorders have the highest mortality rate amongst all mental health illnesses. So it affects every aspect of a person, mentally, physically, emotionally, but especially physically. And I know that you have so much of a part in that, in terms of helping people to understand how important their health is.
So interesting also, I looked at some of the age demographics of this as well, and it really is just such an incredibly broad spectrum. So people that are incredibly young and people that are incredibly old. What do you see mostly in your practice?
I see mostly people in my practice around the age of teens into their 50s, perhaps, and I know that seems like a broad range. Sometimes, oftentimes with the teenagers, it's the parents that are wanting them to come into therapy. And then for those that are older, and I've worked with, people from, like I said, very, very young to people who've been a lot older, who've been very severely compromised by their eating disorder for many years. When I used to work in the hospitals, I worked with people who took were on Medicare and were seriously compromised, not only by an eating disorder, but by a lot of other comorbid and co-occurring issues, which often accompany an eating disorder. And so those patients were very severe.
Talk to us about the different kinds of eating disorders. I know most people are going to be familiar with bulimia or anorexia. Talk to us about the different facets of it.
Well, most of the time when people think about an eating disorder, they think that the person has to have a fat phobia, and that is definitely something that is pretty typical of someone who has an eating disorder, that they're concerned about calories and, how they look and their body image issues. But you don't necessarily have to have fat phobia in order to say, for example, have anorexia. And I know that in the DSM that's one of the criteria, but I had found in my research that depending on your cultural background and all of that, you don't necessarily have to have a fat phobia. By definition, to be anorexic, you're highly underweight, and if that underweightness is affecting your health and your body, and you have food restrictive rituals, and it's something that is becoming invasive, then you have anorexia, and you need to look to help in order to figure that out and get better.
Interesting. So, and also, can certain different types of eating disorders be brought on by other different types of trauma in a person's life, whether or not they've been abused as a child or whether or not they suffer from low self-esteem? What are some of the things that bring on eating disorders?
So let me go back and say there's also binging and purging. There's also compulsive overeating. And there's also an eating disorder that's non-specified called EDNOS. So the eating disorders themselves take on different forms. It's not just anorexia, and I just want to make that clear. And every eating disorder really takes a toll on the human body, but every eating disorder also has specific traits in terms of the way it presents. And the way that I go about treating people is not from a cookie cutter perspective, for lack of a better terms. You really have to work with the individual and see what's at play with them. And oftentimes an eating disorder is not just about food or weight like people think it is. It's really about the way the person's trying to cope with their environment and the way that they're really trying to self-medicate themselves. So they're combining food and mood in a way that's very toxic for them. And depending on their rituals and their cycles, they get into some very, toxic behaviors and habits and self-sabotage. Now, going, to your question about what's underneath that and what's underlying that is usually a perfect storm of different attributes and characteristics of the person in their life that come together in such a way that cause them to use an eating disorder as a way to cope. Now, not everybody who experiences trauma, we're all human, we all experience painful memories or painful experiences, but not everybody who goes through that obviously develops an eating disorder or an addiction.
So for some of these people, is it a way of them crying out for help, or do they not even recognize that or realize that they need help and that this is their only way to be able to deal with that trauma in their life or that memory?
And it's a little bit of both and, to your point. Basically, like I was saying before, it's a perfect storm of different issues. Number one, most of the people have pile-ups in their life that I call pile-ups from their everyday mind, and those pile-ups can come from events that are currently happening, financial issues, different types of stress, relationship problems, and they basically lack the coping skills to deal with how to prioritize their life and how to maintain balance. Lack of self-awareness, lack of mindfulness, lack of being able to set boundaries in certain areas of their life. Some really basic but very important skills, and also being able to speak their truth about what it is that they need and want and what's most important to them. And that's really at a basic level. So as human beings, when we don't do these things, we end up developing pile-ups and life just becomes overwhelming for us. Now, it's someone who has an addiction or an eating disorder. They have some other things going on as well, such as what I call core negative belief systems. And these core negative belief systems might be, I'm not good enough, I'm not worthy, I'm not loved, I'm unwanted. And those are some pretty key ones that actually a lot of people have these negative core belief systems, not just people with eating disorders. And how these negative belief systems are formed are coming from experiences in their life that cause them pain. And those belief systems were formed out of those experiences. And sometimes people have, experiences with abusive people or negative relationships and things that just have happened to them that have caused them to form these beliefs. So there's that level as well. And there's also the level of, the eating disorder that sort of takes on a life of its own. And oftentimes that eating disorder voice, that part of them tells them, you'll feel better if you do this. And part of them knows that it's wrong and the other part of them feels right doing what they're doing. And oftentimes that voice is reflective of somebody in their life that they've had a really bad experience with. It might be an abusive partner or mother or father or someone in their life. So it's all pretty complicated, but they're using the eating disorder as a way to escape their life as they know it and into another existence, another experience of perhaps self-control or peace of mind, or perhaps feeling empowered in some way, feeling a sense of freedom. And so for that moment that they're acting out on their eating disorder and whatever eating disorder that might be, they're feeling that.
Interesting. So as we've spoken about many times before here on RTR, that basically our brain is a hard drive and it's programmed by our MFTP, mother, father, teacher, preacher. So if a person comes to you with an eating disorder, how do you carefully maneuver around that, pulling back the layers of the onion, so to speak, and getting to the core of really what's driving them to that addiction? And second part of that question is, can a person really get help if they don't want the help?
Okay, so let's try to tackle the first question first. Try to tackle the second question first. A person can get help even if they don't want it, but it makes it a little bit more complicated it may be slower for the treatment process because essentially they'll be coming in as a visitor and not necessarily a customer where they're in it. And oftentimes you see that when maybe a parent or a loved one is forcing somebody to go into treatment against their will. And hopefully that person's in the kind of environment that allows them to see the benefit and the value of being there. And when they start to have these sparkling moments in the course of their recovery process, they really start to see that they're going and moving in the right direction and that they want to be there, and that they're able to release the eating disorder behaviors and some of the negative behaviors and see the value of that, because nobody really wants to have an eating disorder or an addiction. It's not delightful, it's not a great thing, and nobody really wants to choose to have that in their life. But when they see no other avenue and they see no way out, they use this as a way to help them kind of get through the day. So they have to begin to see the light, and that's where, my work works very quickly to help them to relieve, their mood, depression and anxiety, and begin to see, developments in some areas where they've been stuck in. And that really helps them to get the momentum and to have a safe place to know that they're with a practitioner who really, knows this and knows what she's doing. To answer your question, a lot of practitioners really do have a hard time with someone with an eating disorder because there are so many different levels and the matrix of their experience is so complicated, and that trauma piece is so important to work on, but it has to be worked on in the right way, because if it's not, it can actually trigger their symptoms. So there's a real balance where sometimes the practitioner tries to work on the roots of the issue, and because they're not working on it maybe in the right way, it's starting to trigger emotions, suppressed emotions coming out, and it's starting to trigger other symptoms. Or if they try to work on the eating disorder without some of the other problems being resolved, then the eating disorder can start to get worse. And also on other levels, people have to understand that every aspect around them has adjusted to who they are and how they've been participating in life. So even as someone gets better, the practitioner has to be very aware to help this person to grow organically in their environment, in their setting, and also help everybody else to adjust so that they're not sabotaging the patient that they would like to see get better. Anytime that I take on someone, I evaluate them first, and I do an assessment and strategy session. And in that assessment and strategy session, I really look at their past, their present, and their future, and look at all of the different aspects of their psychology and their way of thinking and their health, and how all of these, the physics of their life and their relationships. And through that, I can tell how I would need to work with them and over what period of time usually, and how I would be able to see the results developing based on how I work and based on how I think they're going to respond. And really what this is about is helping to reshape the person. They're helping them to develop more positive belief systems and helping to curb negative emotional reactions that are causing them to want to engage in this destructive behavior.
Interesting. Earlier on in your answer, you mentioned the word quick, to be able to quickly get to the person or make a change. How quickly can somebody expect change when they are coming to you as a patient with the so-called problem?
Well, change is a matter of levels, when you're talking about someone with an eating disorder, because as you know, focusing mostly on the functional medicine aspect of health, that even when you are nurturing the body, it does take the body time to heal and to grow on its own and to respond to whatever treatments that you're doing. So obviously, the more focused and the more targeted and advanced the treatments are, the quicker they will be able to respond. But at the same time, there's only so much sometimes that the body can do. And that's why the timing of the interventions are important. And that is why you do also have to give a person's body some time to be able to respond to the treatments as well as their mind. So usually with an eating disorder, I would say minimum we're looking at about 3 to 4 months of intensive treatments and to help the person to begin to regain balance. And then once we get to that level, then we're trying to maintain balance.
Interesting. So, again, I'm just curious because for people who want to be there and people who are being forced, so to speak, to be there by their parents, do you see a difference in success rate between those two different types of patients that come in to see you?
I think that's a very good question. I find, though, that as long as they show up, they seem to get the results because a lot of the work that I do accesses the subconscious anyways. And I think that the biggest roadblock that a lot of patients have for themselves in the recovery process is showing up. And sometimes people won't show up because they are getting the results. They start seeing, oh, well, I feel better. You know, my anxiety is gone or my depression is gone. And they start to see these improvements, so they believe that they're better. And sometimes people may not come as often as they could because maybe they're not seeing the results as quickly as they want to see the results. So that is, I think that is something that every practitioner has to be aware of, and that's why we do programs to try to keep people on a structure in their treatment. To understand that this is part of the process of treatment. And when certain interventions may be done now, we're not going to see the results necessarily of those interventions until maybe a little bit later down the road. But there's certain ones that we're going to see right away. And so we don't want a patient to sabotage themselves. And so we want to put them on a structure and help them to see, make slow and steady progress as they're going through that period of time with me.
Direction, not perfection.
Yeah, which is also a big thing for people with eating disorders, of that whole perfection aspects of wanting to be perfect and look perfect physically or perform perfect and try to achieve others' expectations. And really people have to understand is that this is really about them, and this is really about them living the best life that they can live. And at the end of the day, you know, they're an expert at their own experience, and that they're bringing in, you know, all of their experiences and the data that they bring into me. And I'm an expert at the theory of change and helping people to the physics of change and helping people to overcome their own sabotage and helping people to those reactions that they don't want can disappear so that they can see reactions that they do want to just emerge almost effortlessly for them. And they say, oh my gosh, like I was a little bit happier today. And I found myself being able to, you know, stand up to people in a way that I didn't before. And these kinds of sparkling moments that start to help to bring them momentum. And sometimes they don't really understand completely how they've happened. They just know that they happen.
Interesting. I know change is a big trigger word with people sometimes. People like what's familiar to them. Bad, good, or indifferent, it doesn't make a difference, but the word change and knowing that they have to step outside of their comfort zone. I know whenever I'm working with somebody nutritionally wise, I do very similar to you. I do an entrance interview to find out what their expectations are, to find out what their expectations are of me as their nutritionist or coach, and to make sure that those expectations are real. And quantifiable as well. You keep mentioning treatments. Can you talk to us a little bit about what those treatments are for the audience that doesn't know what that is? I'm sure it could sound very foreign to somebody or very scary.
Well, it's very interesting because oftentimes we'll have patients call us and they'll say, do you do cognitive behavioral treatment? Do you do DBT? Do you do this and that? And yes, we do. I do all those treatments. I do many, many different types of therapies. But I want to say something, because I know that people, when they're concerned with the problem, they do a lot of reading, and they should. But the model isn't necessarily what is going to cure you, okay? It is a tool, like a tool that you have in your toolbox, but you have to know how to use it, and you have to know when to use it. And just the same way that an artist uses a paintbrush. And this is not this is not a cookie cutter type of therapy. This is more of like a therapy that is customized and designed specifically for you, as individual as our individual fingerprints. So that is really going to be the kind of therapy that is going to help you to grow organically in your life and in your environment, and the kind of change that's going to stick for you. It's not going to be something that, okay, I'm going to do this regimen for 20 or 30 days, and then all of a sudden you start to see your behavior start to slip back, right? Because that wasn't real change. That wasn't a change that really fit for you. So this is really about making changes that fit for you. One of the things that I do is hypnosis, and I think that any therapy is really about language. It's not about that's our tool, okay? And we're using language in a way to access a person and a person's mind. And the interesting thing is that a lot of people, when they come to therapy, obviously, they can't overcome their own resistance. They have enough negative ideas in their head that cause them to not be able to listen to themselves, right? So this doesn't work by way of me telling a person something that they've been telling themselves for the last 10 or 12 years, or maybe other therapists have told them that they haven't listened to. It's just because I have a degree. If I say the same thing, it doesn't mean anything, okay? But we use certain lines of questioning when we're asking questions, and the way that I put words together. And I have certain techniques that I do where basically I am helping to reprogram memories so that we're not reliving a memory, we're revisiting the memory when we have it. And a lot of people actually struggle with PTSD. PTSD is it's very, very common. It's not just something that veterans have. It is something that is a natural reaction, and our brain actually processes traumatic and painful experiences very, very different than normal memories. And when we have a painful experience, our bodies react to that chemically, this, and, our cortisol levels and every part of our body responds to what's happening, including our minds. And through the creative process, our minds open up in a way that's called dissociation, where we dissociate in order to protect ourselves from what's happening at the time. And it could be that maybe it's a breakup with a lover, or maybe you just got fired, or maybe you've been in a car accident, or someone that you've loved has died. There could be so many different possibilities and reasons why you might be reacting the way that something just really scared you and came out of nowhere. And oftentimes when the traumas are repetitive, it makes it a lot worse. I mean, I've worked with abuse survivors and cult abuse survivors and satanic ritual abuse survivors and people who have had extremely severe traumas from a very, very early age. And sometimes it's something that could have happened when you were 14 or 20 or 30 or 40 or 50 or maybe throughout your life, okay? But when this happens, because our brains aren't working the same way as they work when we're not experiencing traumas, we are left with everything is heightened for us, okay? And we're left with remnants of emotions from those experiences. And those emotions might be anger, they might be frustration or fear or sadness. And we are also left with negative belief systems. So what happens is our brains don't exactly know the difference between what's happened in the past and what's happening right now, in a way, because if you're in a relationship, for instance, where you might be experiencing some abandonment, or you're feeling like your brain is pairing that with maybe an experience that you could have been 20 years ago, even though emotionally you think that you're over it. And then what you might find is that all of a sudden you're acting out in anger, you're acting out from a place of fear, and you're saying, why is this happening? And this happens to people all the time. Okay, and then they end up in these perpetual cycles in their life and relationships and even in their own decision making. And a lot of it's coming from the subconscious. So one of the things that I do is I really look at, how did you get to where you are today? And you were born whole and complete. And what were the things that happened to you that caused you to begin to have anxiety and depression? And how did then this take form in your life? And okay, so, maybe it was that your parents got divorced and you realized that there was a lot of there was a lot of stress in that relationship, and that led you to start to have anxiety and depression. And then you ended up, starting to see a therapist because you were cutting yourself. Okay, well, where were you cutting yourself? I ask these questions because they give me clues as to how the person is processing information. Okay, all these things become clues to me. And okay, and that might have led you to, other types of problems down the road and other traumas and relationships where you found yourself in a bad relationship where essentially, you were essentially dating your father, right? The person who, might have acted like your father because maybe you wanted acceptance or what have you. And then that didn't work out. And then you got raped. And then, so you see that there are a lot of people that one event leads to another, leads to another, leads to another, and this ends up with sort of like this onion effect to get them to where they are now. And some people have trouble accessing certain memories. Some people have blocks that they have, and that. So basically, after all of this said and done, I have to figure out how I'm going to reshape them by I'm opening doors to certain areas of them to heal those areas so that they can maybe find their voice again, and maybe be able to speak because perhaps they had a parent who shut them down or they had a lover who shut them down, and from that experience they stopped feeling like it was okay to be heard or okay to speak their mind. Maybe there are certain parts of them that, need to be healed. And so I go in and I heal those areas. And then you start to see the person come to life.
Fascinating. I love the distinction you made earlier between relive or revisit a memory. I think that's a fabulous distinction. Similar to other addictions, or maybe not, when we take a look at an alcohol addiction or possibly a drug addiction, which usually have very frequent relapses through the course of getting better. Do you see the same thing with eating disorders as well?
Well, people have to understand also the chemical and the physiological consequences to any kind of toxic behavior, whether it's eating disorder or substances. First of all, alcohol has an effect on the brain where it shrinks the brain. And I find that alcoholics can be particularly challenging to treat because of the way that alcohol actually affects the brain physiologically. And a lot of alcoholics are functioning, okay? And because of their functioning, they tend to be more in denial of what's really happening. And you have a lot of, functioning alcoholics that they are, they're accountants, they're lawyers, they're successful people. And then at night, they're going home and they're drinking wine on one hand and water in the other. And so they're watering their wine down, and it's has an effect on the body. I mean, the alcohol is like turpentine to your body. And but they are particularly because of how the alcohol blocks memory and blocks emotion. Actually, the more emotional a person is about something, the easier it is for them to be treated. If they are not then those emotions are suppressed, and then that becomes another level that I have to access first to be able to bring that out in order to get to the other level that I need to go. But when we're going through a traumatic experience, we're actually writing that memory in our mind through our emotions. So we have to rewrite the memory through the emotion, actually. And so if you can't access that, it becomes a little bit of a problem. Now, there are other therapies that can be utilized, like, for instance, cognitive behavioral therapy is a very, very known and utilized form of therapy, but people have to understand what the difference is between cognitive behavioral and, say, some of the therapies that I do, which I also do cognitive behavioral, but cognitive behavioral, the way I like to explain it is more, let's just say you have an anger management issue, you have an anger problem. Cognitive behavioral is looking more at how can we manage your anger? What are the consequences? Why did this happen to you? What are some of the things that you can do to calm yourself down when the anger comes up? And that kind of thing, more of using your logic to self-regulate yourself. On a deeper level, what we like to try to do is to eliminate the anger. Try to actually get to the core and eliminate it so that when similar situations come up, you're not reacting with this anger, that you almost kind of have a shield. So it's totally different, Something that I recommend for addicts, especially if you've had a long-term addiction to whatever the substance is, heroin or cocaine or whatever your, preferred substances have been, is to actually get a SPECT scan. And a SPECT scan is a very, very advanced scan that looks at how your brain has been affected by your life and your nutrition and everything else. If you've had a head injury, whatever you put in your body actually affects your mind. So what these SPECT scans show is blood flow to different areas or lack of blood flow to those areas and oxygen levels to different parts of your brain. And when we see a heroin addict's brain in a SPECT scan, we see a lot of holes in the brain, like a sponge, like one of those, what do you call them, like those ocean sponges or something, and you see that. And when you see that, that's a very scary thing to see. I mean, that's reality checking right there. When you see that is how your brain is looking like right now. Now, if you have holes in, say, your cingulate gyrus, right? This is a very technical term, your cingulate gyrus. Well, the cingulate gyrus in your brain is connected to impulse control. It's connected to obsessive behaviors, right? So if you have compromisation, if you're compromised in that area of your brain, then it is going to affect your behavior. You see, and people think that some of the way that we act is a choice. And sometimes it isn't. When you actually look at how the brain, that's why nutrition, Doug, is so important, what you're doing, because people have to understand that, and we've talked about this before, about, the importance of your gut health in your brain health and how your gut and your brain are connected to each other. Very, very important topic for people, because one of the biggest problems that I think people have is turning to psychotropic medications as a way to Band-Aid their issues without actually getting to the root of their problem. Now, I think a lot of that blame is our culture and how we've learned and we've been trained by society to believe about ourselves and what healing actually looks like. So I think some people are just doing what they think is the right thing to do. And then the more experienced patients who've already gone that route with medications, they've kind of come to see the light and they've realized, I really don't feel that much better. Now, and I know I'm kind of, feel free to stop me at any moment, but, gut health, so important to brain health, crucial, because our neurotransmitters are also created in the gut, and our neurotransmitters are something that is part of our brain health also. Those are the chemicals. We have excitatory neurotransmitters and we have inhibitory neurotransmitters. Neurotransmitters that help to stabilize our mood, neurotransmitters that help to keep us a little bit more motivated and focused, also our cortisol levels, our epinephrine, our norepinephrine, GABA helps to calm us. And these are all neurotransmitters that are naturally occurring in our bodies. So we have to be aware of restoring the proper pools to our neurotransmitters so that they're working properly, and making sure that we have the proper balances of those neurotransmitters as well.
Agreed. And I truly believe in what you're saying as far as it's all connect the dots, mind-body connection. And you're right, the majority of my studies and research for the past several years has been the microbiome and gut health, and literally how it does affect the brain, and in particular the cerebellum and the amygdala part of the brain, and how it can actually shrink or actually grow. So it's fascinating to me, again, to see how the body changes hour by hour, day by day, year by year, and how it, again, conforms to what it's being given or what it's being told or fed. So, yeah, spot on with that stuff. I give you a lot of credit.
Something that your listeners also need to know is that we have this idea in our society that if you're anxious or you're depressed, it's all chemical. So oftentimes people rush to a psychiatrist and they say, "Oh, doc, I just went through a death in my family and I'm feeling depressed." And the doctor says, "Okay, here's a Lexapro or here's a Prozac." And then what happens is with a lot of these patients is the next thing is that they're on another medication because, now they have anxiety. So they're back at the doctor and the doctor says, "Okay, here's a benzodiazepine, which blocks emotions and all of that. Okay, take that." And then they have problems sleeping. So then they're back at the doctor and they're on a sleep medication. So now they started with one, now they're on 3, and they're not that much better. They're just kind of going through life like a zombie. And the reality is that if you suffer from anxiety or depression, it may not be all chemical. We have seen that there are patients whose serotonin and their dopamine levels are pretty balanced. And in reality, it's a problem with their programming. Their amygdalas, if you see them on a scan, they're all blown up, like they're emotionally flooded. They can't take any more emotions. So their chemicals are okay, but their programming is off, and that's really where the therapy comes in.
Totally agree. And it's really funny that you mentioned that. I recently had a client come to me who was on Prozac. She was just recently given Prozac in the past 3 or 4 months. Didn't feel great being on it. She felt as though that she was really violating what her philosophies and principles were as far as trying to maintain a healthy and natural lifestyle. And I said, "Well, talk to me a little about what's going on in your life right now. Why are you on the Prozac?" She said, "Well, my parents are recommending it to me. They just went through a very painful divorce. They just sold my childhood home that I grew up in. While I was still at the house, they had people going through the house that were looking to purchase it, coming into my room saying, 'Oh, we're going to turn this room into this.'" So she goes, "These were all things that were making me feel bad." I said, "You're supposed to feel bad. Anybody would feel bad under that situation.
Right.
It's okay. You have to deal with the feelings, not block them out." And I think that's the problem with our society today, is that we're all looking for a quick fix. And you mentioned psychotropic drugs earlier. I always encourage my listeners to watch a great film, a documentary called The Drugging of America. If you're not familiar with it, it's a great film just about how they are so overly prescribed in our society today, thus leading to all of these cascading side effects that people are experiencing today now. Not on just 1 or 2 medications, but on several medications. And now they're coming up, as you just mentioned, with a medication to cure the side effects of the other medication. And the latest one, which I love, is the constipation medication. That if you're on opioids now, we have a medication to help you with the constipation that you're experiencing from the opioids. Really? It just drives me absolutely insane. So when you do your therapy, is this in person? Is it on the phone? Is it something that people have to come to? And actually, is it in-house that they're required to stay there? How does that work? What does that program look like?
Well, I prefer face-to-face. I do have patients that fly in to see me. They will sometimes fly in for a weekend, and then we do distance while they're away, and then they fly in again. I do distance my methods do work at distance. It is a little bit harder as a therapist to do that, okay, because when you're seeing someone behind a screen versus on your couch, but if the techniques, they work, they work. And I think that like any practitioner, over time, you become better and better and more effective. And, the techniques they do work. So they work whether you're in Europe or they work whether you're here. And if I'm seeing you over a screen or over, in my office, they work. But in person is definitely better.
Okay, there are no limitations is my point to how you can treat people.
Correct.
Cool.
Correct.
That's really cool. You'll appreciate this. A couple of years ago, I was sharing the stage with some very big known speakers, and Deepak Chopra and several others. And I kept thinking to myself, what could I do to make my talk a little bit different than everybody else's, rather than just getting up there and spewing information for 2 hours? And it came to me right before my talk. I actually called the hotel restaurant. I had them send up 500 napkins. And I had everybody in my audience blindfold themselves. Well, it was really funny because probably about 14 to 15 people got up because they couldn't handle not having this sense of vision to be able to sit there and listen to the talk. And as I started to get into the talk, it was amazing the boundaries that were overcome for some people because they didn't have the fear of being judged or being looked at by somebody next to them or across from them when I would ask certain questions about how they felt about their nutrition or themselves or what were their biggest fears in life. And by the end of the talk, I literally had people up there that had such a fear of public speaking, which we know is the number one fear, that were up there speaking to the entire audience and ripping their blindfold off. To me, it was a real cathartic experience to really be able to take somebody's sense away and literally take them to new heights. And it certainly sounds like in your practice that's what you do and what makes you different than other therapists that are out there, in the sense of you really take a look at a person's past and dive into, again, the entire person and how we are all, as I say, biochemically different. So you're looking at not only what their experiences have been, but also basically what the body has been giving from a nutritional standpoint or whatever.
Everything, absolutely. And I want to just say, because I'm not past oriented, okay? I'm future oriented. And so when we're looking at the past, we're only looking at the past in a way that's going to help you to redefine yourself for the future. And it's basically every one of my patients is in the process of reauthoring their story and their life, because really the past is in our minds now, right? The past is not, it's real to us, but it's really in our heads. And our brains have neuroplasticity. So whatever's happened to you and however your brain has changed, you have the power to be able to heal it and to change it. And I really love the concept of reauthoring yourself and your life, because the possibilities are so wide open for you that no matter what's happened to you in the past, that because we have the possibilities of being able with this advanced therapy techniques to reprogram your mind to be who you want to be and how you want to be, that really the future is so wide open for you, and your possibilities to be everything that you are meant to be can actually happen, that you don't have to be a prisoner of who you were yesterday. You don't have to be trapped or a victim of circumstance. You don't have to be what everybody else has told you to be. You can actually become everything that you want to be. So I'm very future-oriented, even though we do have to look at aspects of your past to break free and to help to unlock you from the chains of those experiences.
Bravo. And as we always say here, is your past doesn't equal the future. And I love the analogy, if you've ever heard this before, if you're sitting in the front seat of your car, you have a big, huge windshield in front of you, which is looking at your future, and yet you have a little small rearview mirror, which is looking in your past, which is exactly how that equates to what your whole life has been up until this point. Awesome. Give me one big success story that really stands out in your mind without mentioning any names.
Oh my gosh, there's so many. There's so many. Recently, I did a testimonial on a patient who was, this is something that people, it's not an eating disorder patient, but it's somebody that probably a lot of women and people could relate to, as somebody who is really stuck in her life for many, many years. And, when you're stuck in your life for so many years, you don't see the forest beyond the trees. You're just kind of living life in a rat habit trail, on that rat wheel. And what happened was that this patient had discovered that her significant other of many years was cheating, and her discoveries validated that was really the truth. And this patient had wanted to get to a divorce and was not able to sign the papers at the last moment. She literally dropped the pen because she couldn't do it, and moved back into the home and realized that he was still doing what he was doing, and that she was very, very unhappy in the situation, and that caused her to bring up a lot of her own, reminisce about a lot of her own experiences and traumas and things that happened in her own past that shaped her to be in this relationship and be where she was. But this had been going on for so long that she didn't see a possibility in opening, because this is just life that she knew. So she had came into me, and she was very, very depressed and confused and stuck. And this is someone who was in her older years. And she really wondered how I was going to be able to help and to reshape her. And basically at the end, this is a woman who she started out not loving herself. She started out not understanding why she didn't love herself. And her story ended with a woman who became someone who could stand up for herself, someone who was happy with who she is, someone who felt liberated, someone who was able to say that she needed a divorce, and she did, and she basically started a new life for herself in a much more empowering way. And she was just extremely elated and grateful for everything, that she felt healthier and taking care of herself. And she said that it was life-changing.
Bravo, way to go.
Yeah.
That's got to be so incredibly fulfilling to you.
Yeah, it really is. And, I take so much pride in each of my patients, because for me, they mean so much to me. Quality of my work means so much. And they're not just a patient when they come in, they're really somebody. There's somebody, and they're a human being. And I really, for every person, I don't take on everybody, I'm able to see through to a person's heart, who they really are in spite of their circumstances. And I really want to help people that I think are going to be going back out in the world and giving back in their soul in a positive way. And so I'm so proud of so many of my patients that maybe they were stressed in their life, or in a bad place where they were unmotivated, or they couldn't be all that they thought they could be. And then following treatments and everything, they really came out of their shell. And I see them, and they're successful, and they're giving back, and they're far exceeding so many of what I thought my expectations were ever for them. But sometimes I'm turning on the television and I'm like, oh my gosh, that's my patient, and performing, and just, or they're mothers or grandmothers, and they're happy.
That's awesome.
Happiness. Can you buy happiness? It's not something you can just walk in. You have to put some work into this too. It's not just something that comes to you. But I think it starts with making a right decision for who's going to be on your treatment team, and that's something that's where it starts. Really, is getting the right treatment team to help you to be the best that you can be.
Well said. So I always say that this profession I didn't choose, but it chose me based on some early childhood experiences that I had with my own health. So I have to ask the question, so what allowed this profession to choose you? Was it anything in particular in your early years that led you to where you are now?
It's really funny. Everybody always says, well, why did you become a psychologist? Did you have all these problems? And most psychologists try to resolve their own problems. And that really wasn't my case. I had problems the same way that a lot of people had problems. But it really wasn't like I got into the field to resolve my own problems. I feel that it was more, I always knew from the time that I was born, if this makes sense, that I really wanted to make a difference in the world, that I had a purpose here, and that was something really important to me. And, as you know, I started my career in television and in media, and at the time I was writing a lot of negative stories, and that really wasn't what I wanted to do. I wanted to reach out to people in a way that could really move them and inspire them to be all that they could be. And I ended up in this field because, it bridged so many different areas of interest that I have: health, healing, overcoming obstacles, and philosophy, science, sociology, culture. There are so many different, it's very multidisciplinary, actually, what I do. And you really have to have knowledge of so many different areas to understand the human mind and the person and the physics of their life. And I find it very fascinating. I love a challenge, and I'm an artist too. And I love art and dance and art, and drawing, and I'm creating. It's human art, It's a form of art. It's human art, and it's art and science in one, where you're basically molding a person into what they want for themselves, not what I want, but what they truly desire. And to have that ability to do that and to heal them and to see that happiness is something that really money it's priceless,
Love it. Well said.
It's wonderful. It's just a really wonderful thing that I can bridge my true passions in life with, in a way where I can make a living as well. Not many people can do that. They work here and they volunteer there. And just like every day that I leave my work, I just feel so fulfilled.
Well, money is an exchange of energy, so the universe is providing you with some so that you can make a bigger difference in the world, is the way I see it. And the other cool thing about this, too, is that you're living your legacy rather than leaving a legacy. And there's a big difference in that, because you are leaving your footprint on the world. So good for you. So if any of our listeners want to get in touch with you or want to know further about your treatment programs, how do they do so?
They can visit www.therenewcenter.com, or they can call 1-800-509-0244.
Fabulous. And I'm sure I'm going to get this question a lot, is will people be able to work directly with you?
They will.
Fabulous. Well, I can't thank you enough for being on our program this month. I'm sure it's going to have an impact on quite many people. So I would love to invite you back in the very near future. And thank you so much for being our guest.
Thanks so much for having me. I enjoyed being here.
Sounds great. Thank you again.
Thank you for joining us on RTR. We hope you enjoyed your bit of education. We don't take health lightly, so please join the countless numbers of RTR subscribers in spreading the word on wellness. You can follow Doug daily on Facebook and Twitter. Here's to your health.